Sure. Okay, so good evening, everyone. I am Paramjyoti Chattopadhyay, and I am a monitoring and evaluation specialist at DMU Niti Aayog. And I would like to extend a very warm welcome to you all for the fourth DMU panel discussion as a part of the Glocal International Evaluation Week. So today's topic of the discussion is large-scale evaluation of government programs in a data deficient ecosystem. So this is the last panel discussion in our series on monitoring and evaluation within the government, with special reference to cases from the Government of India. So before we go any further, I would like to run you through the housekeeping rules for today. So we will start with a brief opening remarks from each of the panelists, and then we will go into the discussion, which I will facilitate. And after that, we will have audience questions. And finally, we will conclude with brief closing remarks from each of the panelists. And that's how we conclude the session. So this is a webinar format, so the chat is disabled, but we will take all your questions through the Q&A module. So please type in your questions with your name and organization names so that we can take them up with clarity during the Q&A sessions. Speaking from experience of our earlier sessions, there were a lot of questions from the audience, about which we are very happy that, as it means that there is a lot of interest from the audience regarding these sessions. But unfortunately, since the time is limited, probably we won't be able to take all your questions. But in case you have any questions which are unanswered, so you can obviously mail us those questions and we will take them, we will respond to those questions later on after the session is over. So, okay, then let's move on to the introduction of our esteemed panelists. So it gives me great pleasure to introduce our eminent panelists for the day. We have with us Mr. Anthony Syriac, who is a Deputy Director General at DMU Niti Aayog. He is a member of the Indian Economic Services from 1996 batch and has worked across various Indian ministries and departments of the Government of India on areas such as industry, infrastructure, public finance, microeconomics, and India's development partnership with other countries. Before joining the DMU, he was an economic advisor to the 15th Finance Commission of the Government of India. Earlier, as a part of the program evaluation organization of the erstwhile Planning Commission, he was involved with the evaluation of many government schemes and programs. We also have with us Professor Anis Sugathan, who is an assistant professor at Indian Institute of Management, Ahmedabad. He is a faculty of the strategy area and co-chair of the Advanced Business Analytics postgraduate program at IIM Ahmedabad. He is also a visiting research fellow of the Sustainable Futures program at the Institute of International and Regional Studies at Princeton University. We also have in the panel Ms. Tripti Sharma, who is a research director at Ipsos Public Affairs. She is an international development professional with 25 years of experience in research and evaluations. She is passionate about delivering high quality research and evaluation that impacts policy and generates evidence for strengthening development programs. So she has done her master's in social sciences from Tata Institute of Social Sciences, Mumbai. And finally, we also have with us Ms. Maike Bijkar, who is a monitoring and evaluation specialist research at UNICEF India. She leads the evaluations commissioned by UNICEF in India, as well as provides technical support to research, studies, and monitoring activities. She also leads UNICEF's external capacity building efforts in M&E, supporting partnerships for evidence across all UNICEF programmatic domains. Before joining UNICEF, Maike worked as a senior research manager at JPAL South Asia in Delhi. She previously worked with Delberg in London, Sneha, and the University of Cambridge, UK. So Maike holds a master's from LSE and a master's from the University of Cambridge, UK. So I again extend a warm welcome to all the esteemed panelists. And so now, before we go into the opening remarks, I would just like to set the context briefly for everybody's understanding. So large-scale evaluations require not only ample resources, time, and funds, but also quality baseline data. However, the sectors, as we have seen, is mostly devoid of adequate baseline data, which hampers the pre-evaluation understanding of these large-scale evaluations. So this has been particularly the case in many of the government schemes and programs in India. So this session would discuss the approaches adopted by leading evaluation organizations to undertake large-scale evaluations in this kind of a data deficient ecosystem. Specifically after COVID-19 pandemic, which has posed another layer of challenge in collecting data. So the panel will also share ways in which they have changed the implementation of the evaluations due to the the COVID-19 pandemic. The session will also explore mitigation techniques of risks which are envisaged with a large-scale evaluation, specifically in an ecosystem which lacks data. And it is therefore in this context that this discussion will take place. Now we will get into the opening remarks. I would first request Mr. Anthony Syriac to make your opening remarks, please. Over to you, sir.
Thank you, Mr. Chattopadhyay. It's my pleasure to be here, and dear all esteemed panelists and everybody present here. The subject of discussion is large scale evaluation of government programs in a data deficient ecosystem. Since I am the first speaker, let me try to define the topic, the components of the topic in a specified way. See, I see there are three clauses to this topic. One is the scale of evaluation. Second is the data sufficiency. Third is the relationship between the two. And that is the motivation behind the choice of the topic. So the scale of evaluation, let me come to the scale of evaluation. Large is sufficiently ambiguous. So what is large? And the largeness of an evaluation, I mean, it's a trivially clear point that it depends on the largeness of the scheme. The size of the scheme depends on defines the size of the evaluation. If it is a countrywide scheme catering to diverse populations and with many ramifications, of course the scale has to be large, very large, to capture the conclusions effectively. So now to exemplify with the Indian context, the largest of the schemes of the government of India, which is the NFSA, the National Food Security Act, has an implication of 1 full percentage of GDP. It's around 2 lakh crore, 200,000 crore. It's a percentage of GDP. And which is the smallest? Smallest is around 1 crore. So that is the range. It's a range. It's a ridiculous range. 200,000 crore to 1 crore is the range of the size of schemes. So I mean, so even if the 1 crore scheme is not even worth being evaluated, you can just study it on a desk level basis and define the need for its continuity. And then coming to the data sufficiency, here it is raining heavily. You would hear the noise from here. So the data sufficiency, what is data for evaluation? Data for evaluation are the baseline data. If a proper baseline survey was done and if the baseline has been constructed, and second is all the secondary sources, the set of secondary sources, which include secondary administrative data, survey data, and then all the research, rigorous research done around the topic. So this is the context. This is the context which an evaluator faces. Now, in this context, let me try to briefly explain the travails of an evaluator. So now, suppose the first, I define actually 3 scenarios. It's for easiness of explanation. So one scenario 1 where the baseline data is not available. So okay, baseline is not available. So I am unable to do prima facie. I am unable to do a before-after approach. So okay, so so I mean, still as an evaluator, I would see that this is a surmountable difficulty, because I would draw from the richness of the available survey data, administrative data, which may be longitudinal, and then I would substitute for the baseline data, and then I can start comparing with the current data. So this causes a problem, but it's surmountable. Second, okay, if I don't have even the secondary sources to mitigate the non-availability of baseline, that's a more difficult problem. So then what can I do? Then the methodologies will have to be different. If I can run an experimental design, I can run a quasi experimental or fully experimental design. So I mean, there are many methods which are available to handle this. So, and then if experimental designs are also not possible, because let's take a scheme like NFSA, National Food Security Act. Its coverage is over the length and breadth of the country. Now you can't experiment to draw your conclusions. So in those cases, and especially when my the goals are not properly quantitatively defined, I will have to impute notional goals to evaluate. And still, even for these limitations, I would say these are surmountable limitations. And the third scenario is where I need money for implementing the second scenario. And in the third scenario, I don't have the money to do it also. That is a kind of a plight. It's a predicament for an evaluator. I'm not supported by enough money to overcome my problems. That's a predicament wherein the evidence shows that the external agencies chip in with their efforts. So now I would end with one particular distinction. Now I have been describing the travails of an evaluator, but the concerns of an evaluation framework are different from the concerns of an evaluator. Evaluator is concerned with the availability of data, design, etc. Whereas the framework has to do with shall we move to the next slide, please? The framework has to do with a larger set of variables. I mean, I have listed 4 variables here. Executives' appetite for comprehensive feedback. That's an absolute must for larger scale evaluations. And if the process of evaluation is integrated with the budgeting in the country, that will completely facilitate. I mean, it will lubricate the process of evaluation. You will have to do evaluations to complete your budgeting process. And of course, the resource commitments for evaluation, the clarity in policy milieu. That is very important. I think I get a chance to expand this particular point later. And I stop by saying that even if the first 3 are secured, if the last is not secured, I'm not safe as an evaluation framework manager. Thank you very much.
Thank you, Mr. Seriak, for the excellent opening remarks. So it sets the context very well and gives a good overview of the different scenarios which you talked about of data-related challenges and evaluators may face. Another important point you made regarding the differentiating between the evaluator and the evaluation framework is that how evaluators' appetite, resources, and the policy clarity can affect the evaluation framework. I think these points are very helpful in setting the context. So now I will go to Professor Sugarton for your opening remarks. Over to you, Professor Sugarton.
Setting the ball rolling on this front. And thank you, Mr. Chattopadhyay, for the nice introduction. Very generous. Thank you. Let me just quickly, build on the conversation which both of you have, mentioned. One, of course, is the scale of interventions that we're talking about, and second is the question of impact evaluation. So I would build on these 2 notions and bring in the context of low data, low quality of data, low quantum of data as a context, and see How do we evaluate scales at large scale programs like what Mr. Sirak was mentioning about, let's say, the National Food Security Program? Can we move forward with the scale, with the slide, please? Right. So there are two things to any evaluation program. At the core of every evaluation is a program intervention. There must have been some sort of a scheme, some sort of a project, whether it's for national food security, it could be a primary health infrastructure development, it could be a public infrastructure development. There is always an intervention, and this intervention is always done with a certain intent in mind of the policymaker. Say, for example, I want to conduct national food security as a large-scale program. And the intent of this program would be to improve the nutrition input of the citizens of the country and therefore improve their health outcomes and welfare. That is the eventual outcome. There could be subsequent outcomes because if people are healthy, they would have better lives, maybe are more productive, human capital improves, productivity improves, and so on and so forth. That is the eventual outcome. When you're looking at a program from an evaluator's perspective, one always wonders what exactly is my immediate outcome that I want to measure. Is it good enough for me to see, let's say, if it's a primary healthcare program, I can always go to the field and check how many primary healthcare facilities were actually built, how many buildings are on the ground, and how many buildings were before, something I can quickly check. But if the intent of the program is to measure health outcomes at the intended population, then it becomes a complicated problem for an evaluator. I can always, set up a school. I do not know whether that will improve the education levels of that intended population, the eventual outcome that one is trying to measure. And it is precisely here data deficiency becomes a big problem. Say, for example, I'll only talk about two major issues, and I will give one example where we are able to use some clever data manipulation to circumvent some of these problems. One, of course, is a baseline problem, right? Let's say you are rolling out a primary health scheme. I would like to know, before the scheme was set out, what was the state of the universe? What was the state of the target population? Knowing that is very important because then only I'll know what is a before and after impact on the target population. But that itself is not sufficient. It is predicated on the assumption that nothing else is happening before and after. There are no other interventions which are happening, and this is the only intervention that is impacting the target population. There could be multiple other interventions which the government may be running, maybe the NGOs may be running, maybe the community itself may be going ahead, and there could be a trend. How do you distinguish the impact of the program which you implemented with all the other counterfactuals that could have existed? It's like saying, we implemented a very large, a very strict shutdown, lockdown for Corona to contain COVID. The counterfactual question would be, what would have happened had it not been there? Would there have been a difference? That's a counterfactual, impossible to see world that I need to reconstruct. And sometimes baseline is not good enough for me to reconstruct that. I know what was the caseload before, but what would have been had there been no intervention, that becomes the key data problem for me. If I may go to the next slide. Yeah, and this problem I called, reconstructing a good control group, or what we call generating a credible counterfactual, and that becomes the guiding lamppost for most evaluators. Sometimes the baseline itself becomes a good counterfactual because there is no other intervention happening, or because the outcome, there is no other source of disturbance to the target population. Sometimes when multiple interventions are happening, the baseline is not good enough. I need a control which would act as an alternate for the target, which would have been had there not been an intervention. Now, to illustrate the point, if you may shift to the next slide, I will quickly give you one example, which is something that we were doing here at IMA, some of my with my research team. We wanted to know what is going to happen, what happened to the pollution level from vehicular traffic in places like Delhi and other urban areas in India because of the COVID-19 lockdown. So the intervention in this case was the lockdown. The impact that we're trying to look at is the air quality, right? And the problem here is what is a baseline and what is a counterfactual? The baseline, which we would look at would be, oh, what was Delhi's pollution before this intervention was happening? But the problem is air pollution is always confounded by meteorology. What if it was also raining heavily while the lockdown was happening? So it's very difficult to disentangle that. So what we do is, in this particular example, we use a machine learning algorithm. If you see the right-hand side bottom panel of Delhi, we identify hotspots of economic activity as the red zones. And we also look at the adjoining areas with lower economic activity using nightlight data as the control region. And that we try to use as a counterfactual. So if you go to the next slide, this is an indicative slide of what I want to convey. The red line that you see over here on the top is the control. It's a target population. It's a target population on which an intervention has happened. The blue is the control line. The vertical line shows the period of intervention. When we're talking about baseline, I'm trying to compare the red line before and red line after. But what I really want to compare is the dashed red line, which is the counterfactual. Had there been no intervention, the red line would have followed the dashed path, the dashed red line path. But because of this intervention, it had fallen down compared to the control. And I can only do that if I have a credible control which was not affected by the same policy. And this is the idea in principle. And if you see the results, in the next slide, it clearly shows out as a design. So in the bottom panel, if you see, this is 2019, the pollution levels of Delhi, the core of Delhi at the top in red, and blue are the control regions. If you see during the implementation phases, phase 1, 2, 3 in 2019, there was no lockdown. You see there is no difference between red and blue. But if you look at the top panel A, there is a drastic shrinkage between the core versus the periphery, which means the activity in the core compared to the control in the periphery drastically dropped down. And that drop becomes my estimate of the impact of that policy of lockdown. The final slide, if you see, using this kind of a design, this is a quasi-experimental design. We are able to estimate, for an example, in Delhi, Mumbai, Hyderabad, and the other major cities, the causal impact of lockdown on air pollution. Now, I can go on and see what is the impact of this on health outcomes and on whatever else is the target that I'm looking for. So this is an example I just wanted to show how when counterfactual is not available, when baseline is not a good counterfactual, how it is possible to create a synthetic counterfactual from secondary data and therefore fulfill the requirements of evaluation. I hope that I'm sure that we will have more detailed discussions on the different institutional aspects of this this issue going forward. With that, let me stop and hand it over to you, Mr. Chattopadhyay.
Thank you.
Looking forward to
Thank you, Professor, for your opening remarks and sharing your valuable insights on various methods and tools for reconstructing the baseline or the control group as the case demands in absence of actual baseline. So just to give an example, like in DMEO also, we have conducted an evaluation of the centrally sponsored schemes where we conducted about 125 evaluations across the country over several sectors, like about 10 broad sectors. So lack of baseline there also was a major issue. And in certain cases, this reconstruction of the baseline was also done there in certain cases where proxies and recall questions were used in the household question. Yeah. And then they were triangulated with the secondary research and the KIs and the FGDs, which were conducted parallelly. So which was quite useful. But anyways, like it was a very helpful the way you introduced this concept here today for further discussions. Thanks a lot. So now I would like to request Ms. Tripti Sharma for your opening remarks. Over to you, Tripti.
Yeah, thank you, Param, and thank you to the esteemed panelists for kind of setting the context for the discussion today. And good evening, everyone. And we really appreciate you taking time to attend this session. And I would like to also thank DMU and the other organizations for thoughtfully curating the sessions to discuss these various aspects of evaluation. So as the topic suggests, I think the data and a good quality baseline data has always been a challenge. And we know that the root cause is the weak data ecosystem and the capacities at different level. So in the time that is allotted to me, I will not necessarily dwell again on the issues of why the baseline data doesn't exist, but instead share our experience at Ipsos, where we partner with diverse clients for their evaluation needs. And while doing that, I will also share some examples of how we have designed and adapted ongoing assessments and evaluations during the pandemic. So to begin with, like in an ideal case, yes, a robust baseline seems to be a critical ingredient or a requirement to plan an evaluation for its obvious merits and the advantages. But we, in our experience, have seen primarily two kinds of challenges with regards to baseline. And I think Professor Anish also adequately highlighted that one is the lack of baseline, which is the data itself it doesn't exist, and the second is the poor quality of baseline. And I think we can have the various point of views about what is actually a serious problem, no baseline or a poor quality of baseline. And I think all of us may have been in this situation where we have experienced this in some way or the other. So the question is how to plan effective evaluation when the data ecosystems are deficient, is something which is a common question or a concern that we are often faced with. And maybe it may sound a little conflicting, but our simple answer would be that yes, baseline is desirable, but it should not be a limitation in designing an effective evaluation that is situated in local context of data sufficiency. So if we are paralyzed by the fact that there is no baseline data, so we cannot carry out the evaluation, I think we are going two steps backward. So the requirement would be to understand what exists and then plan our evaluation accordingly. And in our experience, initiating conversations with some fundamental questions always helps scope the evaluation and expectations from this evaluations. So some of the fundamental questions, like though they may sound very basic, I think we need to revisit these basic questions as to what is the purpose of the evaluation? What do we want to achieve? And I think my earlier two panelists did highlight about what kind of data do we want. If it is an impact to demonstrate that certain percentage of improvement has happened, or is it to learn the lessons from the implementation, or what contextual factors have contributed to the success or the failure of the project? So if that, what is the purpose, how the findings will be used, who are the stakeholders who are going to use this finding, and what is the act framework to answer these evaluation questions are some of the basic fundamental questions that we need to always start with. Many a times there is a tendency that people come as external evaluators, or when a brief is designed, it's like the evaluator will have all the questions or the golden bullet of finding out what will work best for the program. So in our experience, that has not really worked. What has really worked and enriched the evaluation process is a uh, consultative process that is followed not only to scope the evaluation to, but also continue, this consultation should continue throughout the evaluation stages. Some of the other considerations that has helped deliver effective evaluation is that always having a framework that helps or define frame evaluation questions. Many a time we have a standard thought process of what we want to see from evaluation, and it could be either quantitative or qualitative data. If I don't see the numbers, then I'm really worried about that this evaluation is not very effective. It doesn't tell me what percentage of change has happened. So what is the framework? What are the indicators that we want to evaluate? Is there a theory of change for the program that exists, or any other framework that can guide us to do this consultative process and come up with a framework that will help us to scope the evaluation? The second is that again, using a mixed method approach, which would mean like looking at the primary data, the secondary data, and secondary data not only related to the project, but also that goes beyond the project data. Sorry, there was some echo in the background, so I was just trying to fix that. Yeah. So looking at mixed data, again, as evaluators or researchers, if we have preference for certain type of data, we try and customize the evaluation accordingly, saying that this is something that the numbers only should be there, or the qualitative data is not merely answering. But looking at primary, secondary data, and secondary data not only from the project or that has been generated, but also beyond, which gives us the larger context. Because nowadays we all see that the programs are not intervention doesn't happen in vacuum. There is a larger social context, cultural context, there are spillover effects. So it's very hard to contribute the success or any impact to one particular program. And that is where the secondary data beyond the project is also helpful. The other advantage of looking at primary and secondary data would be it aids the triangulation of the findings and the learnings, which is again a critical aspect of the evaluation. And I think Professor Anish and earlier also Professor Anthony highlighted that we can look at the selection of the control groups wherever applicable and possible. Again, if it's a large scale evaluation, if we are looking at a countrywide program that has been implemented, there may not exist a control group. So we need to be mindful of that and see that, okay, if there is no control group, what are the different alternatives that we can do that. Param also spoke about some of the centrally sponsored schemes that were evaluated. We had the opportunity to work on the evaluation of some of the schemes that were implemented in water, environment, and forest sources. And that's exactly what we did. We engaged with the key stakeholders throughout the process in terms of scoping, forming up the evaluation questions. There was data collected from stakeholders, starting from the village level till the central level. And there was a small component of the quantitative data collection, which helped us to form up or develop the evaluation findings. So to summarize, what I would like to say is that we need to have an adaptive approach, which is iterative, and it responds to the stakeholders required who are asking for the evaluation. And the second point is the credibility of evaluation is also higher when we are transparent about the scope and limitations of approaches adopted. We can't say that this is the perfect solution, and if we have implemented this, there is no question asked. Every approach will have its pros and cons. So as long as the evaluation outlines what are the scope and limitations of the approaches adopted, it's a good place to begin when reviewing the evaluation. Coming to the second part of our discussion, all of us have been living with the pandemic. So while the pandemic necessitated the need for data like never before, but it also pushed us to explore alternative data collection approaches. So the slide that you would see is a summary of our learnings and adaptations that helped us in continuing our partnerships with diverse clients for evaluation and assessment of different programs. To explain this, I will just take a minute to talk about two examples. So, and I'm sure it will resonate with most of you and my fellow panelists that there is no perfect solution, because when COVID hit us, we didn't know what was the alternate way. India is an offline data collection country. We have never tried, at least in the social sector, telephonic interviews or online because of issues around representation. But then when the demand or the need for data was there, we started with less than perfect solutions. And after a year, we can fairly confidently say that we are not handicapped or paralyzed because the face-to-face data collection cannot happen. There are alternatives which, if implemented with the correct understanding and experience, will generate data. It may not substitute face-to-face data collection, but it does give us data which helps us to take the program forward. some of the things that we did for our study that was implemented for one of our clients was establishing an assessment for a program that was intervening with girls and women. So the data collection had to be done in 4 states in rural area where women are not necessarily digitally connected. They don't have access to phone. So we tried and worked with different methods. We worked with the stakeholders to generate a database. We partnered with them to facilitate introduction of the survey, what we want to do, divided the questionnaire into smaller modules to collect the data. We did telephonic interviews. We used WhatsApp, which is predominantly kind of present and people are using it. They're very comfortable. So instead of implementing or introducing a new app or something which people will not be familiar with, we created WhatsApp group with a different set of stakeholders and participants to collect data. And it did help us collect very rich level of data, establish contact, continue the conversation, and we were able to complete that assessment. Again, some of the other approaches that we used for a pan-India evaluation, the Niti Aayog study that we spoke about, was again using a hybrid approach. So if we are not able to go to the field and collect data, but there are local resources available who can facilitate access to the communities, we used our local field staff who went to the villages and communities, brought the group together, and they served as a technology link, and the researchers were able to connect report remotely and conduct qualitative discussions. And we did huge volume of data collection. They were all recorded, analyzed, and we had robust quality check mechanisms to ensure that the data that is collected is validated, confirmed, and then feeds into the evaluation report. So I would say that partnerships and building the capacity along the way is something which is going to be key to strengthen our data ecosystem. It's not going to be a magic wand which if we just turn and we will become a strong data ecosystem, but it's a journey, and I'm glad that all of us are part of that journey, and we will reach a stage where we would be probably not talking about so much about data deficient ecosystem. So to conclude, I would just say that any deviation from an established practice of conducting evaluation calls for us as professionals to unlearn, except that we may not come up with a perfect solution, but jointly through consultation, we can explore opportunities and innovations which will help us to continue collecting data and contribute to the learnings. So I'll pause here and I'll be happy to take follow-up questions. Thank you.
Thank you, Tripti, for the elaborate opening remarks. So you talked about an adaptive approach which is perfected along the way, along with the use of digital platforms, hybrid models, and collaboration. These are all very important points we will discuss further. So now I would like to request Ms. Maike Bridgker to make her opening remarks. Maike, over to you.
Thank you very much, and very happy to be here with everyone. I apologize. I think I have no power, so at some point I'm going to get darker and darker. So I apologize in advance. So I think actually I'm sort of glad I'm going last, because I think I'm going to echo what all of the wonderful panelists have said before me. If we can go to the first slide. So I'll briefly run through this. First, I want to take a step back a little bit, because may not seem very obvious to many people that UNICEF actually does a lot in the field of evaluation and in terms of providing technical support for evaluations. Actually, if you think about the way that we support achieving the Sustainable Development Goals, specifically for children, one of the main tools, I would argue, in my profession, but also even more so, I think, with the COVID situation, is really the need for evaluations. We need to know what's working, what's not working, and for whom, so that we can actually achieve these really ambitious goals. So UNICEF, we work across the world and in India as well to really support large-scale often government schemes and programs, evaluations of those. And I think, like the panelists have already mentioned, that these evaluations are complex and challenging. They require time, funding. We talked about high quality data, specifically the baseline data, which is a topic for today, but also other data infrastructure related issues. But I also wanted to mention here, and this is, I think, an important point that Mr. Anthony had also mentioned, for large scale evaluations, there's really a political economy of evaluation. So if you can imagine, you're trying to do an evaluation of the Swachh Bharat mission, whatever comes out of that is going to be quite political. So I think that is something not to forget either when we think about doing large-scale evaluations and to defend the credibility often. The next slide. So what are some of the solutions coming back to undertaking evaluations in a data deficient ecosystem, and specifically not having a baseline? Because that is a problem. If we don't know where we start, we don't know how far we came. And I think the panelists have already very, very accurately highlighted this. Similarly, we can use methods to approximate the baseline. I think that was already discussed with existing data sets or retrospectively constructing a baseline through recall, quasi-experimental methods, establishing a control group or a counterfactual. But I also want to highlight something that we are ourselves experimenting with is actually methods that don't require a predetermined indicator at all. Something that we have used in the past, along with other tools, is outcome harvesting. That's really a technique where you start at the level of outcomes, a systematic qualitative technique where you analyze outcomes, and then you try to trace, well, what was responsible for these outcomes and see where the program fits in that. So that's actually one of the tools that we can also use. And I think what was also mentioned before is that actually a baseline is not sufficient, for sure, to establish impact. But I also would say, as Tripti had said as well, we don't always need a baseline depending on your objectives. So for example, we use for UNICEF evaluations or evaluations that UNICEF supports the OECD DAC criteria, and they are beyond just effectiveness and impact. We also look at relevance. So is it actually meeting the needs of people that you're trying to help or support? Also coherence, how does it align with any of the other programs that are out there that are trying to achieve the same objectives? So I think you can still do evaluations even when you don't have a baseline, and even in the worst case scenario 3, that we don't actually have these mechanisms in place. And so I very much echo, I think, Tripti as well, that at UNICEF we use hybrid models. So we combine different designs and different methods. I've put some examples in the box. One of them is an impact evaluation from Nigeria. I'm trying to make it a little bit more international to learn from other countries. But something that UNICEF did there was an impact evaluation of birth registration in Nigeria. And actually what we did there is a combined approach of quasi-experimental design, which is constructing this counterfactual, very much like we've seen in the example before, to establish the quantum of change, but also process tracing, right? Because establishing the quantum isn't enough. You also need to know what the nature of change is. Why did it happen, to establish attribution or contribution, actually, more accurately. So that's a hybrid model we actually very often use, and it turns out to be more feasible as well. And something I wanted to highlight is that we are also more and more exploring with modeling. So we have done a macroeconomic impact evaluation of the Swachh Bharat mission, where we actually used existing data sets to construct a baseline before SBM, and then for every year see what the impact was. Of course, it has its limitations, I think, but it's a really interesting way to explore looking at evaluations. COVID brought challenges. Again, I think Tripti explained those well, and I will talk a little bit more, hopefully, in the panel discussion about this. We had to change a lot in our evaluations, but we also were forced to innovate with remote data collection modalities, and we actually did this with decent success. So I think a lesson is we can do it. The last slide. And then finally, I think it's about what do we do moving forward in with large-scale evaluations in a data-deficient ecosystem. So the first thing is you can obviously try to focus on resolving the data deficiency and strengthening the data ecosystem. I think that's definitely the need of the hour. And actually, I think under this DMEO panel series, there was a whole session on the admin data and how to strengthen that. And I think that's a really important topic. There's also an interesting example, which some of the DMEO folk may know about from Mexico, from Coneval there, where actually what they've done is that every 2 years, they run a sample survey that measures multidimensional outcomes, multidimensional poverty outcomes, sorry. And that means that every 2 years, which started in 2008, means every 2 years they have updated data on the indicators that are defined under multidimensional poverty. So you can imagine in a large-scale evaluation, if you actually want to evaluate what the impact is, what has the change been essentially over time with the program running, you could use that as your quantum of change, and it keeps going every 2 years. So even multiple schemes could use that as the same source. Of course, you would still have to do some sort of theory-based approach to establish contribution. Like I also said, use a variety of approaches and designs. You don't always need to have evaluative findings around effectiveness and impact to still be useful. Learn for COVID, like I said, actually, we have learned that we can better integrate remote technologies, and I can talk a little bit more about that. And then finally, I think this comes through really well, especially I think what Mr. Anthony was saying, that you, at the end of the day, trying to run a large-scale evaluation is really trying to ensure that the whole system is on your side, the whole ecosystem is on your side. So you need to ensure buy-in and uptake by the end users, by essentially the policymakers, and that has to happen through institutionalizations, systems, capacity, leadership, and culture. And so I think that comes to play here, which is again another session I think the DMEO ran yesterday, if I'm not mistaken. So that is it for me. I think some thoughts and happy to answer my question.
Yeah, thanks, Maike, for your opening remarks. So now, since the context has been quite well set, so now we will take a deeper dive into the topic and start the moderation discussion. I would request all the panelists to be brief in their answers because we are already running late. So with that, I will just start the moderated discussion. So I will go in the reverse order, and my first question will be to Maike. With the onset of new evaluation methods like remote data collection, digital technologies, etc., so how do you envision it to play a role in large-scale evaluation, and how do you think it would change the way evaluations have been done so far? So, Maike, over to you. Would request you to keep your answers to the brief. Thank you.
Thank you. Yeah, I think there will be many answers to this, but I think how will it change? I think and I hope that we'll be able to leverage remote data collection more in our evaluations. I think traditionally, perhaps especially in India, we sort of default to the in-person survey modality because it's what we're used to. And I'm convinced that through COVID, it forced us to innovate and that we can actually, and we have learned that you can actually do data collection remotely quite well in certain instances. And in fact, actually, we're doing 3 evaluations entirely remotely at the moment because we had to adapt. So I think that shows that we can adapt. Of course, I think the challenge remains that how to reach the representative sample in this way, right? And I think Tripti also mentioned that certain populations, especially in India, women, adolescent girls, and various other groups cannot access mobile devices. So actually getting their voices or outcomes related to them is problematic. But I think through triangulation, we can do that quite well. And also if we can, use methods such as leveraging existing databases, which are representative, that we can still reach and do a sort of sampling in which we can, a sort of quota sampling, as it were, to make sure that we have enough of the people to make the sample representative. I was going to cite an example, but I'm not sure we have time. I do think there's a question around whether or not so your second part of the question, how will it change evaluations? Now, I would hope that we actually integrate this remote modality more like a regular practice, which would also make it sort of cheaper. But like I said, again, I think in part it will probably require a bit of a strengthening of the whole system to make sure that we can actually reach people remotely. And also a bit of a culture change, I would say, in my opinion, that we can actually do this. So I'll stop there.
Right. Thank you, Mike, for this response. It's great to know that your views are on the changing scenarios of evaluation and how digital technologies can assist in large-scale evaluations. So we will get back to this on more afterwards. So now I will go to Tripti. So Tripti, in your opening remarks, you talked about that how the data collection paradigm is shifting. So I will continue from there. So being a leader in the field-based surveys and research, how do you implement large-scale evaluations when data systems are weak or often missing in the evaluation process, and how important is the baseline data, and how do you implement evaluations without it? So over to you, Tripti.
Yeah, so thanks, Param. I think as I rightly said that yes, baseline data is not always important, and just acknowledging that it is not there will help us to shift our focus on what is possible, and that is what we have been doing. There are many projects where the baseline is not there or is a poor quality. And many a times we fall into the trap of adhering to the baseline. We come up with a similar poor questionnaire because these questions were asked in the baseline. We need to retain it. And we are happy to work with some of the partners who are okay to kind of just let go of the baseline numbers, which don't add value to any learning, and take a fresh look at the evaluation. And what has really worked for us is engaging with the clients and the stakeholders in understanding how this evaluation will be used. So going back to the basic fundamental questions and understanding why do they want this evaluation to inform, whether it is to replicate, whether it is to learn what worked, what are the lessons, or to kind of continue or take decisions about policy and scale up. So once that is known, I think through the methods that we spoke about in terms of one thing I would just like to flag is that yes, there is deficiency of data ecosystem, but human resource who are involved in the planning or implementation are good institutional memories, because those are the people who have implemented the program. Going back to them and discussing with them based on recall, developing the framework is something that has helped. Just to give one very brief example, there was a program which was implemented, there was no baseline. So we worked with the stakeholders, we helped them to come up with the theory of change, like what did they do, and they revisited the entire program, reconstructed the theory, which helped us to come up with the indicators, and then we were able to collect the data. So that's something that has really worked. And again, triangulation is something that is part of the process.
Thank you, Tripti, for your response. It explains very well how you're adapting your approach towards evaluation in this kind of a data constrained ecosystem. Thanks a lot. So now for my next question, I will go to Professor Sugatan. So India is a highly diverse country, as we all know, that we have so many states, union territories, different development levels across the country. Inequality also, there are also variations in inequality between regions, between states. So Mr. Syriac also mentioned in his opening remarks that there are so many schemes at both central and state level which are being implemented simultaneously. So from an academic standpoint, what is your view? How should large-scale evaluations be conducted in such a diverse country like India? So what are your views on this, Professor? Over to you.
It's Mr. Chattopadhyay, that's a tough one. I wish you would have asked that question to a practitioner, not to an academic. But let me try to take a stab at it. All right. So yeah, first of all, the scale of the evaluation is directly linked to the scale of the program itself. Right. So a national food security program by design it touches everyone. So it's not possible that we have a small program intervention and we have a large scale evaluation. It's the scale of the intervention basically it decides. But I have a few thoughts, and I think that should add more value to this conversation. I felt is given the data deficiency as multiple reasons at multiple levels of the value chain, and second, the diversity of the context. It essentially pushes the practitioner to take a break and move beyond what we call the standards of rigor, which is set in peer-reviewed academic journals when it comes to, and take a more pragmatic view on what is implementable, right? In fact, of the entire universe of programs that is out there, probably 70-80% can be done in a fair, evaluation can be evaluated in a fairly good way. But if you want to adhere to the strict academic rigors of evaluation, probably less than 10% would have all the data that one would imagine of. So I think the pragmatism is important, and a more fundamental, I believe, and I really like the two novel approaches which Mike was talking about: outcome harvesting as a tool, and focus on process. The process tracing, that is absolutely critical. One may, I don't really have to label it and call it process tracing. Essentially, the entire qualitative study field is trying to understand the underlying causal mechanisms that is leading to an outcome. A trivial example, for instance, is, let's say we want to roll out, let's say we want to contain the current, I mean, I'm simply overwhelmed by the context of COVID that we are all in the midst of. So all my examples are flowing from there. We want to contain the spread, right? As a policy maker, I may say, let's roll out vaccine, right? So one of the outcome would be how many people are vaccinated. I can simply count that. But then I am completely relying on this knowledge that vaccines are effective, right? So that is process tracing, as in, if I give vaccine, would it be effective or not? That is a solved question. It is solved a priori. I'm taking that knowledge and bringing into the context that, I don't have to worry about efficacy that has been tested separately. I would look at how many people are actually vaccinated, right? I can take the same example. Think about schools, right? Would providing free midday meal be helpful? Would better meals lead to better nutrition? That is kind of a solved problem. So getting to the input side, and because you don't have output measurements, and you can sort of fill that gap using alternate context, knowledge which is coming from different contexts, different places, different geographies, which are not going to be changing, which are immutable. Like the efficacy of a vaccine, if it's proven in one context, it's probably effective here, maybe less, more or less, slightly different. So those are the ways I believe, I guess, pragmatism needs to take a leading step in case of the large diverse context like India over academic rigor.
Thank you, Professor, for your response. I think these are very valuable insights. Unfortunately, we are running short of time, so we have to quickly move forward. So I'll next move to Mr. Syriac. Probably this will be my last question from this particular section of the session. So Mr. Syriac, you talked about that some of the crucial questions regarding the evaluations from evaluators' perspective. So taking a cue from that, my question to you is that given your years of experience in evaluation, what would you say are the prerequisites of large-scale evaluations of government schemes and programs? So could you elaborate on some of the pertinent challenges that are faced by the government in conducting such large-scale evaluations? Over to you, sir. Sir, I can't hear you.
Sorry. So I want to atone for my failure to stick to time in the beginning. So I have 4 points. One, demand, money, academic resources, policy clarity. These are the prerequisites. And if there is demand, which is the executive's commitment to the evidence-based policy, if that is there, then money should be there. And the other day UP government was commenting that they want to set apart 1% of their schematic expenditure for evaluation, and their schematic expenditure is 60,000 crore, and 1% is, to the least it is 600 crore, and I think it will be around 1,000 crore. 1,000 crore is a huge mass for an evaluator if I take a state. So that all these are not the constraint. I mean, I just want to go back to my initial point that there should be policy clarity. There are 700 central sector schemes of the government of India. At 54% of them are below 100 crore. Below 100 crore in a large country like India, 54% of them. And their total expenditure is 0.7% of the universe. The biggest 6 schemes out of the 700 account for 48% of the expenditure. Once I clear the mess, and if I have clarity, I can have large scale, small scale, whatever. Thank you.
Thank you, sir, for your response. I agree with when you said that there needs to be kind of a prioritization of schemes in the central and the state level for the evaluations. So with that, I think the discussion so far has been very interesting and insightful. So we could have continued with this for a long time had we have time with us. So unfortunately, due to the time constraint that we can't do, and we have to now stop this session here. So unfortunately, because the time we have already crossed the time, we are unable to take the audience questions in this session. So we have covered a large, a very varied kind of topics under the discussion, and I'm sure many of the questions that has been asked have already been answered. But even after this, if some of the audience members, if some of you have any questions, please write to us. We will make sure that we respond to your questions after the session. So my apologies for this. So, but to move on to the next segment of the session, that is basically the closing remarks. I would like to request all the panel members to very briefly, maybe in one or two sentences, just to summarize your thoughts on the future of evaluations you see, evaluations you see in a data deficient ecosystem, just in one or two sentences from each of you. So we can start with Mr. Syriac, and then we will move forward to the other panelists. So over to you, sir.
Evaluation is non-negotiable, unexceptionable. If it doesn't have any priority, the priority has to be established, and that's all. My second point, just a second point, that is COVID will go and we will have to go back to the field. Digital can help, but to a limited extent. Thank you.
Thank you, sir. Digital can help, but to a limited extent. With that, I go to Professor Sugatan for your closing remarks in one or two sentences. Sir, you are on mute, I guess. Professor, you are on mute.
I feel the future is going to move from beyond just numbers. It's going to go more towards understanding the underlying processes. And novel methods and techniques are going to come out, which will unravel the process of evaluation and therefore bringing more knowledge both to the evaluator and the policymaker.
Numbers to process. So so Tripti, your closing remark, please.
Yeah, so yes, I agree with what everybody said. So in my view, I think strengthening the data ecosystem is going to be a journey, and we are looking in terms of future of the evaluation, a place where the data collector also becomes the user of data, because that's where the big gap is, that evaluation can sometimes be top down where we evaluate, but people who are supposed to use data for evidence making are left behind. So I think that bridging of the gap is important, and COVID has definitely given us important lessons, and we hope that these lessons are integrated in further strengthening the quality of evaluations and the options that are available to us.
Thank you, Tripti. So what I understood is basically the data collectors and data users. So bridging the gap between these two. Thank you, Tripti. Mike, your closing remarks, please.
Yes, again, I agree with everyone. I think, to me, large-scale evaluations are not impossible in a data deficient ecosystem. While we can work on it, I don't think they're impossible to have useful findings. And I think exactly, I agree with Professor Sugatan that there are new methods and new approaches that we can leverage on the qualitative and the process side. The second part, actually, that I wanted to end on, because it was something I was going to mention before. When we think of the impact of COVID, we have focused a lot on the technical side, of course, but actually COVID has shifted the goalposts for a lot of existing schemes, right? We have direct impact of lockdown, but also indirect impact of families perhaps not being able to buy lots of food, malnutrition rates going up. So actually the schemes that were designed to achieve something may now be focusing on a different goalpost. And so I think that is really important for us as an evaluation community to recognize and to incorporate in any of the evaluations that we're doing moving forward.
Thanks, Mike. I think we all agree that COVID has shifted the goalposts, and we are yet to see the worst maybe. So let's hope the future is better. So with that, we come to the end of this session. So it was a wonderful discussion, very insightful, very interesting. And had we had more time, we could have gone on for much longer and much more detailed discussion. So with this, we have come to the end of this session. I hope the members of the audience have also enjoyed today's discussion. And I would also like to convey my sincere thanks to the esteemed panelists for sharing their insights and wisdom. It was great to interact and learn from you all. I would also like to thank the DMO partnerships team for the groundwork they have done. They have been fabulous. And also convey my thanks to the DMO senior leadership for their continuous support and guidance. I thank the Global Evaluation Initiative for organizing the Glocal Evaluation Week. This is a fantastic initiative and a great platform for exchange of knowledge, and we have been enjoying this a lot. And finally, I would also like to thank the members of the audience for attending and actively participating in this session. I see a lot of questions have been asked today. We will try to get back to each of you. With this, thank you all and see you next time. Bye-bye.
Thank you. Thank you.
Thank you.
Pleasure. Thank you.
Thank you very much. Thank